Good afternoon, everyone, and welcome to our media availability today and our update. I will now turn it over to Dr. Janice Fitzgerald for the update for today.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since our media availability yesterday, we have no new confirmed cases in the province. The total number of cases remains at 259, and by region we have 241 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. 53% of cases are female and 47% are male. We have 22 people under the age of 20, 38 between 20 and 39, 39 between 40 and 49, 56 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 4 people are in hospital due to the virus, and of these 2 are in intensive care. 244 people have now recovered, and in total we have tested 9,296 people. Together we have made substantial inroads against COVID-19 in our province, and each passing day with no new cases further reinforces that what we are doing is working. I know it's not easy and requires great personal sacrifice from us all, but if we remain dedicated and focused on our end goal, I can assure you that we will most certainly reap the reward. As we adjust to our new reality for the foreseeable future and begin to regain some of the liberties we have lost, please know that life as we knew it will at some point resume, but how fast we get there depends on each of us. It is imperative that we continue to practice good hand hygiene, proper cough and sneeze etiquette, stay home as much as possible, especially if you're feeling unwell, and maintain safe physical distance at all times while in public places. These important but simple measures must continue throughout all levels of our life with COVID-19. As Mother's Day is only a few days away, and traditionally one of the busiest occasions of the year, I am compelled today to remind you that as difficult as it is, and will be for all of us, this year will require a different type of celebration with our mothers. Rather than the in-person celebrations we are accustomed to on Mother's Day, I strongly encourage you to connect virtually this weekend and consider dropping your gifts and cards on the doorsteps of your loved ones instead, unless of course they are members of your bubble. For families with loved ones in residential care homes where visitation is currently restricted due to increased risk for COVID-19, I kindly suggest that you connect virtually this weekend as well. To help alleviate the burden of not being able to visit with loved ones in residential care homes, all long-term care facilities and some personal care homes will be accepting Mother's Day gifts that can be passed along to residents, families, and those we hold dear. The best gift you can give to your loved ones right now is one that helps protect their health and safety so that you can enjoy future celebrations together. As a recap, for those who may have just joined, we have no new confirmed cases since yesterday's media availability. The total number of cases in the province remains at 259. The breakdown by health regions brings us to 241 cases in Eastern, 8 in Central, 4 in Western, and 6 in Labrador-Grenville Health. As this pandemic unfolds in our province, I am truly amazed by how we have come together in complete solidarity to face what will likely be the most challenging time of our generation. The accomplishments we have achieved to date belong to each of us, and I hope you take pride in your significant contribution. Thank you for doing your part, and we cannot do this without you. We must continue to forge ahead with the same diligence, commitment, and resolution we have all so readily shown. We are in this together. Let us continue to make our every action count. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald, and good afternoon, everyone. And we mark another day of no positive cases in Newfoundland and Labrador. And like you, and I just am hoping that this trend will continue into the future. I also want to say that I'm very pleased to hear that over 90 people from Eastern Health who are now safely self-isolating have all tested it negative for the virus. This, for all of us, is welcoming news, and we have done some great work in our province, as you know, following the guidelines to flatten the curve, as been just mentioned by Dr. Fitzgerald. So I, too, want to thank you for your hard work. Our results are proof that physical distancing and proper good hand washing and proper good hygiene is working. But as we make those comments, we always put it with a little but, because we know that we still have some ways to go. And yesterday we had a very productive day in the House of Assembly as we passed some legislation and made amendments to further support you through this global pandemic. And we will continue to work together with you. But I would also like to recognize the great work that's been done through the All-Party Joint Committee on Public Health. The meetings are still ongoing. We meet every morning. But also I want to thank our public sector employees who are continuing to work very diligently to put the efforts that we make recommendations and put those efforts into place. And I cannot go without mentioning, of course, our essential workers, our community heroes, really, in all our communities. And I want to thank them for everything that they're doing at this time as they continue to do and provide the essential services and essential goods to residents within our province. As Dr. Fitzgerald said, that everything that we do and the things that we have done already is about protecting you. It's about supporting you and your family as we continue to stop the spread of COVID-19 in Newfoundland and Labrador. It is about moving towards what will be a new normal of living with COVID in our province. And just a reminder, as I was kind of reflecting on the last month or so, and on April the 6th, as we were sitting in this very room, there were 194 active cases of COVID-19 in our province. Today, we have 12 active cases. So that is truly a testament of the great work that you've been doing in following the guidelines in our province. So supports for individuals and families and businesses throughout the industry, throughout Newfoundland and Labrador, is something that remains a big focus for us. And today, I just want to highlight something that we don't get a chance to talk much about. Provincially, we have a vegetable transplant program. And since it's now springtime in many areas, and although on the West Coast, I hear this morning we've had some snow. But with the growing season upon us, our farmers and producers are committed to ensuring our province's food security. It's something that's been very topical as we've been sitting and updating you on a daily basis. And it's something we will continue to deal through this recent pandemic. So this transplant program has been providing farmers with some high-quality vegetable transplants, and this is meant to increase the variety and the amount of produce that is grown in our province. So to help address the food security needs and provide the extra boost that farmers need, and sometimes in lengthening the growing season, but also now during this pandemic, we are nearly doubling the volume of vegetable transplants that will be available this year. And just for a little history of this, back in 2018, we had just under 256,000 transplants available. Last year, in 2019, there were 1.7 million transplants available. And this year in 2020, there will be 3 million transplants, vegetable transplants that will be available. So to put that into context, that's 3.8 million pounds of vegetables as a result of this program that we put in place. And this will become from many of the foods and vegetables that we use every day in Newfoundland and Labrador: cabbage, or turnip, lettuce, broccoli, and onion, and so on. There are many others. And there will be a number of applicants that will take advantage of this program, some 65 of the eligible applicants that will be available. And all of this happens at a place that we don't often talk about, and not many people in the province would even know about, and that's the Wooddale Centre for Agriculture and Forestry Development. And they've already started, and keeping in mind they started sowing seeds there with all the guidelines that have been put in place by our public health officials. Of course, all of this, we could use a little help, as always, from Mother Nature, and hopefully some good growing weather in the coming months. And then in the fall, as Newfoundlanders and Labradorians, we'll get the opportunity to enjoy the bounty of some homegrown vegetables. And I want to once again thank the commitment from our farmers. But I can't go on and leave the agriculture industry without talking about a little program that I really think has been very successful. And that's to the children, to our K-12 system that have been watching our updates from time to time. And this is about agriculture in the classroom. And this is a partnership with farmers and educators to help our children understand why farming is essential and give them an idea where our food comes from. And I've been able to visit a number of those classrooms, and excited students as they demonstrate the things that they're actually growing in the corner of their classrooms. And today, I've been out on Twitter today just promoting a little promotion that they have out there with agriculture in the classroom. Now they call it Worm for a Day, and this gives you an example of what the life of a worm would be in a compost bin. So I know people are having some fun with it, either by writing or drawing, and there'll be some prizes at the end of this. So I'll be watching closely to see what this response will be. So whether it's our farmers or our local convenience store or our large grocery chains, businesses either big and small are the driving force behind our economy. They create job opportunities, they build stronger communities, they provide employment for our students, and help generate a more diversified economy. But we all know that, like families and like our general population, that indeed businesses are struggling right now. And many of them are struggling in the face of the economic hardships and the uncertainty during the pandemic. The current and the future impacts of this pandemic are evident in discussions that we are having with business stakeholders. And over the past few weeks, various departmental officials, including our cabinet ministers, including our MHAs and their districts, have been working very hard to find solutions that will fit the needs of those businesses. So we want to build on what's been put in place by the federal government and build on their measures to complement in many ways and ensure that our actions as a provincial government are effective and within the physical capacity that we have within our government. We have a number of departments that do a lot of great work on a daily basis supporting businesses. And an example is a part of the tourism, culture, and innovation and industry. And this is about an investment fund that we put in place, and from time to time, we would loan businesses money. So given the hardship that they are currently facing today and just making those payments, we are deferring the loan payments, but also the interest on those loans out now till the end of September. So it's really a deferral of what will be up to 6 months. Also, in the coming months, you will see the priority areas for investment, how we actually can support our business community. And we've already heard from many companies and industry leaders that some areas that we can support them with would be around research and development. It could be around market development or even around marketing activities, which will be critical in the coming months to assist new businesses and even new investments in our province. So to assist in these areas, we are looking at the contribution levels of eligible projects, and in some cases we would have been able to participate at the 50% of the eligible costs. We're now increasing that to 75%. So this is just one measure of we can actually support some businesses, but we're doing more in some ways around research and development, helping those that are eligible to increase the employment and the number of people that they can hire on some projects that would be eligible. So this will in some ways, in some cases, take people that we currently have involved within government that we work with, some 2 positions up to 6, but it's just little ways. And a couple examples that I can give you of the early interventions that we are making as a provincial government. There's a lot more work to be done, and we want to make sure that this is just a start, and we are committed to working with you to find solutions as we come through the health pandemic and into and meeting your demands, making sure that you are in a good place coming out of the COVID-19 crisis into what will be the economic crisis that we will deal with as your government. So the commitment from us is that we will be working with you. We know that you are critical to the rebuild and the rebound of our economy, and it's in all communities, either rural or urban areas, that we rely on you as our job creator. As been mentioned by the Chief Medical Officer, is that this is one of the largest challenges that we will see in our generation as a province. So this virus is a test on us and our residents, and it's by working together that we can weather this storm. So this will be and will go down in our history as a critical period of time. But I'm extremely confident in the resilience of Newfoundlanders and Labradorians. And I know today that the actions of today will result in a good story of tomorrow. So continue to keep your distance, remain socially connected, but stay safe, everyone. And for now, I will now pass it over to Minister Hagee for his comments for today. So thank you.
Thank you very much, Premier. And yesterday I was in the House of Assembly, and whilst I was able to mark it on social media, I didn't have the opportunity this presents to recognise the Day of the Midwife yesterday. And I'd like to give a shout out to a small team, a nucleus, if you like, of a new program that will one day spread across the province and allow greater choice and flexibility for women about reproductive health and childbirth in particular. So to Gisela Becker, Renee, Katha, Brianna, and Maud, thank you for what you have done and what you are doing and what you will do in rebuilding midwifery in this province to the prominence it once had in previous years. Today marks the start of National Nurses Week. And again, they are a group without which the health service and the health and well-being of our seniors and all of us would be very much the poorer. And I would like to mark the beginning of that week with my own personal thanks from years of working alongside registered nurses to wish them well in their commemorations, their celebrations this week, and to acknowledge the work that they do for all of us every day, day in and day out. There are nurses within the Department of Health as part of a tightly knit team, and I think you've seen public health nurses, particularly within the department and across the community, rise to the occasion lately. We have, within the department, dealt with over 6,000 individual emails through the COVID crisis and through our COVID info line that has been directed to health particularly. Indeed, the travel orders and the changes of last weekend generated just 500 emails in the space of 36 to 48 hours. And I'd like to give a shout out to Pam and her staff for the way they have managed to keep their heads above water and deal with the inquiries. A lot of those inquiries, though, I think mirror the ones I see in my own inbox, be it on social media or in my emails. And quite frankly, a careful study of the website, the COVID info website, and the FAQ would actually answer a large number of those queries directly. And I would encourage people to use that for two reasons. One is to help take some of the load off our departmental staff, and the other is to rely on that as a trusted site of information on all matters related to COVID, be it health or some of the more broader societal impacts. We've tried to collate all that in one spot and make it as simple a process as possible for you to find it. There's an awful lot of information there, and I would encourage you to go there. We are now down to 12 active cases, and that would certainly support the contention that the first wave for this province is receding. I would celebrate that and congratulate everybody on their efforts, but I would also suggest that the time is not yet to relax, and as Dr. Fitzgerald said, hold fast should be the theme of the day. Over the last couple of days, we've seen some developments in healthcare, and that's generated some questions. I think one of the biggest topical concerns has been around issues at Eastern Health and a large number of staff being isolated and tested. To update the Premier's figures, as I walked in here, I was handed a slightly revised number. There are 99 staff who have been tested. There's only one result outstanding from today's test. All 98 others are back and are negative. The department was advised of an operational issue around a transfer of a patient from intensive care over the weekend, but really this was presented as something that had been dealt with at an operational level and mitigated. It was only on Monday when we came in the department and started asking for more information that it became apparent that that wasn't quite the case, and we saw this develop rapidly over the course of Monday evening. So that's an ongoing dialogue with Eastern Health, and as I get more information, I'll be happy to provide that. From the point of view of yesterday's activities in the House, the Premier's already alluded to, there are two new changes to legislation. The Pharmacy Act was an amendment to allow emergency registration of pharmacists and pharmacy techs should the pharmacy board feel that there was either a potential or real shortage of either of those two groups, and to allow them the same flexibility that we've been able to do for other professional associations. The difference is that because of the way the Pharmacy Act was written in 2012 versus some of the newer legislation, we actually had to go back as government into the House and seek approval from the House to amend the Act rather than simply write a new regulation. The other piece was around the Public Health and Health Promotion Act, and that was really in light of discussions that Justice and Public Safety had received from our law enforcement officers around the travel order that had been written to come into force on May 4th. Both the RNC and the RCMP had some concerns that they didn't have the ability to enforce the orders as they were written. This was done obviously from a public safety, public health point of view. Our numbers are low, and we know now if we maintain our good behavior, the only realistic way of significant exposure to COVID-19 is through our borders. We had a little while ago designated fisheries and land resource officers as inspectors under the Act, and the Act change yesterday now allows them one extra power, and that is the ability to stop a vehicle, particularly in the context of Port of Basque, the ferry, should they have cause to do so under the order. The other element was around peace officers, where because of the nature of our borders being particularly an island for the Newfoundland portion of the province, was that they felt they needed the ability to locate, hold an individual and bring them back to a point of entry, and they wanted that specifically written into the Act. So that was the consensus of the House yesterday. There was nothing new otherwise. None of these people can enter anybody's house without a warrant. There's no changes in those kind of powers at all. The peace officer definition for the benefits of those who may not be sure in this province is Royal Newfoundland Constabulary and Royal Canadian Mounted Police. So I hope that that provides a little bit of clarity around the need to change that Act, and thank my colleagues in the House for support in maintaining a firm line with looking after the health and well-being of Newfoundlanders and Labradorians. So again, with 12 active cases, holding the line is important. I think the message, though, with the plan that has been outlined by Dr. Fitzgerald is that the fastest way to get where we need to go is actually to proceed slowly, with caution, and keeping an eye on things. So physical distancing is the key. Stay in your bubble, protect your bubble, and don't burst anybody else's. Thank you very much, Premier.
Thank you, Minister. And we now turn it over to the media for your questions for today.
Thank you, Premier. For the benefit of our speakers, we have 7 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. I will call on each reporter by name to ask questions, so please do not press *1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m., and any further questions can be emailed. Our first questions today are from Ben Murphy of VOCM News. Please go ahead.
Thank you. In the House of Assembly yesterday, Premier, you told PC Leader Tess Crosby that you didn't know about the over now 90 healthcare workers in isolation during your committee meeting Monday. Then during yesterday's briefing, you said that you didn't know about it during Monday's briefing. Minister Haggie, you just said that the department started asking questions on Monday morning, so I'm wondering, when exactly did yourself and Dr. Fitzgerald find out about this issue?
From my point of view, I was only aware that there was a problem Monday after the briefing, when the true confusion, perhaps in some respects, around what had actually gone on there came out. Essentially, without giving away any medical details, patient was transferred, deteriorated, went back to the unit. That patient had been transferred with 2 negative swabs, and then on reassessment in the unit had 2 swabs performed, one of which was positive. Since then, that individual has had 2 swabs done which are negative. However, Eastern Health, from an operational point of view, have gone the route they have, and I gave an update about the numbers that have been tested. The issue of the magnitude or scope of this problem, other than it being a simple transfer of a patient from intensive care to the floor, was not apparent to me until later on Monday.
And Dr. Fitzgerald?
Yeah, so as the minister said, we became aware that there was an issue with it outside of an operational perspective on Monday.
Why were you not made aware of this immediately on Sunday?
The question of the magnitude of it was only clear on Monday. One of the discussions we're having with Eastern Health is around communications and timeliness of those. And as I get more information, I'd be happy to share that.
Thanks. And so with the over 90 healthcare workers in self-isolation, and now we've heard that all but just one have come back negative. With what we've heard about testing with false negatives that led to this exact situation, is there any concern now that some of these tests may come back positive and proper contact tracing wasn't done?
From my understanding, the issue is around the way that Eastern Health have approached the problem. The testing is what the testing is. The issue around a person who has a positive test, 2 negative tests, 2 tests, one of which is positive and one of which is negative, and then 2 negative tests, shows very clearly that diagnosis is dependent on clinical things as well as simple testing. This individual, fortunately, would appear to be improving from the information I have. That is the key. The other piece around contact tracing, it seems from the information that's presented through public health to have been managed with exactly the same efficiency as, for example, the Coles outbreak. So I have no qualms or concerns about the ability of public health to do contact tracing.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead. Please go ahead, Peter.
Okay.
Hi, Peter.
Hi, are you there?
We are. We can hear you.
Oh, the question is, am I here? The legislation that was passed yesterday, there's a lot of confusion in the public and the media, even apparently the other politicians. That was caused by the fact that there's actually only 2 changes to the bill, even though all of them were presented and never got a chance. I just want to ask, for one thing, can authorities enter a private dwelling under this bill without a warrant?
No.
Okay, thank you. And do authorities actually have the right to force someone onto a plane or ferry to return whence they came?
I think if you want to discuss the ability of the RCMP or the RNC, then that would be something you should best address to them. The intent of the bill and the act that results from it is under the framework of a special measures order under the state of emergency, that a person who does not fulfill the appropriate criteria laid out in the travel order would be denied entry to the province.
Okay. And nurses, as you're aware, they've expressed a lot of objection. Apparently, a lot of them expressed objection to the transfer of that COVID patient, which later tested positive. And they want to know whether their voices will continue to be ignored in those sorts of circumstances, and whether any protocols will change around how patients are moved within the hospital.
Certainly, from my understanding, the COVID patients from intensive care now will not go back to the general floor. In terms of the criteria for pronouncing a person COVID recovered or COVID free, there is a clinical context, as some people have significant other conditions with them. But this individual was assessed against the protocol, which required 2 negative tests, appropriately spaced, and met those criteria at the time they left the intensive care unit. We meet virtually, regularly, with the majority of the unions involved in healthcare provision in this province, and I am not aware of the concern that you have outlined. Obviously, I will now go back and see if any of that has been yet expressed directly to the department, and I'll get back to you.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Minister Haggie or Dr. Fitzgerald, I'm not sure who can answer this, but now that we know that 98 of those staff members have tested negative, what is the process in giving them the green light to go back to work? Will they need to be tested again and still need to self-isolate for 2 weeks? When can they go back?
So it will be after 2 weeks of self-isolation from the last exposure.
Okay, thank you. And I'm wondering, now that we're seeing such low active case numbers, 8 just outside of the hospital here in the province, will we still be required to have 28 days between alert level 4 and 3, or is this something we're looking at maybe reducing?
No, we will still be looking at 28 days between level 4 and level 3. That is, as I've explained before, that has to do with incubation period and clinical course of the disease. That will not change regardless of how many cases we have in the province, and so that will continue. So if you continue to ask a question, I'm going to give the same answer.
Well, I think if you look back at this, just in context, and as Dr. Fitzgerald just mentioned about the importance of the 28-day, the incubation, two incubation periods. As I just mentioned in my comments earlier, that literally a month ago, we were nearly 200 active cases in our province. And sure, we can celebrate and be thankful that we're down to 12 today, but it just really, once again, I think highlights how fast this can change. And we can go from 12 to nearly 200 active cases in our province just as quickly as we've gone from nearly 200 active cases down to 12.
Right, thank you. I'm also wondering, we've talked repeatedly about our borders and that is the biggest risk of exposure for COVID to come into the province. But yet we're still seeing temporary foreign workers coming in to work in fish plants. If this is deemed an essential service, can we not hire the staff here to do that and reduce the chance of COVID coming into the province?
Yeah, so we've always said that if you can find, someone within our province to work in, the fish processing sector or, whatever the sector is, temporary foreign workers, would come in only if we cannot find the workforce within our province. I mean, it goes without saying that even from the businesses themselves that, find it necessary to bring in temporary foreign workers, it is at a cost to them as well, like accommodations and the extra costs that it had to their businesses as well. So even before you apply, this is a federal program, I will say, that even when you make application for the temporary foreign worker program, is you must, outline your plan of what accommodations would look like and so on, but also the fact that you are struggling getting the necessary people within those communities to actually provide that employment. So for us, if you can find the employment within Newfoundland and Labrador, of course, hire local, hire Newfoundlanders and Labradorians. And then if you can't, well, there's a process in place with the federal government to actually get those supports that you require. Even then, for those that would find themselves in a position where they cannot find the workers locally, if they bring them in, there's the same guidelines that the chief medical officer has put in place, and before they actually go to work, they have to self-isolate for 14 days.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
When you look at the decision on whether or not to detain and remove someone from the province, that now rests with yourself, Minister Haggie, as well as the Minister of Justice. Why not require a judge to be able to make an order and to allow, for example, the person to present their side of the story like we normally do with criminal matters, for example?
Well, this isn't a criminal matter under the criminal code, and I'm not a lawyer, but I'm sure you'll find a lawyer that will agree with that position. The facts of the case are this is an operational issue. These are orders issued under unusual circumstances. They're framed on the context of a provincial state of health emergency. They are framed under a special measures order and criteria under that. If anybody feels their rights have been abridged in any way, they have the right and the ability to go to court and challenge it. And as one of my legal friends said, there is no law that can't be made better by a good court case.
You know, I think too, we must remind people that there's a lot of the emphasis and discussion around the new laws and new legislation that was put in place to support the measures that have been put in place by the chief medical officer. But this is a last resort. This is only if enforcement is required. If someone finds their way into Newfoundland and Labrador without the appropriate plans, and they're here and not here for essential reasons, they haven't had the necessary exemption orders that's required to come to Newfoundland and Labrador. This is very difficult for us as Newfoundlanders and Labradorians. We're a province that are known to welcome people and to embrace people and want them to come to our province. But right now, during this pandemic, what we're trying to do here is prevent Newfoundlanders and Labradorians from being exposed unnecessarily by someone that's coming in without the proper paperwork or exemption orders in place. This is a method, a tool of last resort. You know, we want people to come in with the necessary paperwork done to enter Newfoundland and Labrador.
For comparison, just to flick back, New Brunswick, which has similar requirements and authority under the law, has only used it twice since their state of emergency began.
A lot of people now are taking a closer look at some of the existing measures that were part of this legislation. For example, the fact that it would allow a police officer to search a car or business, force someone to hand over their phone and give them the password if they think they might be violating one of these orders. If they were investigating a serious case like a murder, they'd need a warrant. Why give more power to enforce an order than would be for a more serious crime?
This is a situation, again, in context. This is set against the issuance of a state of public health emergency by myself on the advice of the Chief Medical Officer. It is then set in the context of a special measures order, which is then set in the issue of enforcement if education and encouragement fail to do so. This is designed to be a tiered, proportionate response, and it's designed to deal with the pressing need and a pressing exposure of the public to a health threat. That's the logic behind it, and that's why it's worded this way. And that, in actual fact, if you look in other newer public health legislation, you will find those sort of measures. And if my memory serves me right, you would have found similar issues around communicable disease orders in older legislation. So this is not an unusual approach to a significant, and I emphasize the word significant, health threat.
Slightly different topic. Looking at childcare centers reopening Monday as more workers end up having to go into businesses, are they going to be ready to deal with more children and be able to deal with them safely?
So we've connected with Education and Early Childhood Development to talk about how that can happen safely, and they have developed guidelines around that, and they've engaged with their childcare operators to discuss that. And I think childcare operators have been open all along for essential workers, so there is experience right now in the industry in providing a safe environment for children to be cared for while their parents are working.
Our next questions are from from Patrick Butler of Radio Canada. Please go ahead.
Numbers. I wonder if you could tell us how many temporary foreign workers there are in the province right now, and if you have any numbers, by sector. Can you say how many would have come in the fishery, for example?
Right now, what I would know is not how many that would come in. I would know from the federal government's point of view the number that would be potentially coming to our province. So this is a long process. So people, they make applications as a business owner. Sometimes it could be healthcare related, and many of those that would come into our province would be healthcare related. Some of them could be to support like the fish processors. So right now, I think in that sector alone, I think total there's about 300 to 400 people that could potentially, come into our province. If you put that in context, I think Nova Scotia is probably about 2,500. So this is not unusual. They, come into our province to support agriculture, to support the fishery, to support healthcare, and so on. So the total number that's coming into our province to support the the fish processors right now would not have that number specific to that sector. Typically it's around. Some could have 60, 70, some more could have 70 or 80, but I could get those numbers for you, what exactly will be. But somewhere between 300 to 400 that I know that are approved to come into the province. Not sure if they're all coming though.
As we approach May 11th, there's a question a few days ago about the backlog of non-urgent procedures in this province. I don't believe we got an answer that day.
With surgical procedures, and that may reflect my own bias rather than anything else, was that cumulatively across the province, as of the end of last week, we had slightly over 6,000 procedures outstanding due to cancellations because of COVID.
Thank you. And still 5 days away from May 11th, but we've had very few cases in the past 2 weeks. What would it take at this point not to move to level 4 in 5 days?
We would have to see a significant surge in cases and, in all likelihood, cases that we could not relate back to travel or to a known contact. That would be our first concern or red flag, so to speak. But there are criteria that we have to meet, and I think at this point we have met all 6 of them. So it would take a fairly significant surge in cases, I think, at this point, but hopefully we will not see that.
Our next questions are from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
The Department of Tourism, Culture, Industry and Innovation announced more support for local businesses, as the Premier mentioned also earlier in this call. But Premier, can you explain where that funding is coming from, and could those measures be extended?
They could be extended, and these are just early interventions, as I just mentioned. I would anticipate that there's going to be much more financial support that's required. I mean, this is one industry that will be hit the hardest in Newfoundland and Labrador as you restrict travel and so on from people coming outside of our province. It goes without saying that the tourism industry is one area that will be hit very hard. So we're working with them now through Minister Davis and his group, as well as Minister Osborne. I know they had a meeting this morning. And some of the early interventions are some of the things that I just mentioned, those companies that would have had loans with the province. I think there's about 150 businesses that would be impacted by that. So you have the deferral of loans, the deferral of interest, but also for those that would have new ideas, new opportunities that they see coming through this, that we could work with them to increase the hiring capacity as well. So this is about the engagement with the business community in our province. We're going to need them to be strong coming out of this health crisis. They are the job creators. They're the employers in our province, and we realize that there will be probably financial help that will be required, but also some maybe regulatory changes to help them speed through, some of the processes that will if they need to make some necessary changes in their own business environment. So it'll be I know the level of discussion is ongoing already, and we have a number of cabinet ministers and MHAs are involved. So we look forward to that dialogue. We made a commitment to work with them.
Thank you. And yesterday, Dr. Fitzgerald, you said the test for COVID-19 is very sensitive. And I'm wondering, what's the margin of error? And is the incident at Eastern Health the only case we've had in the province so far?
If you're talking about sensitivity and specificity of a test, for this particular test, the sensitivity is up around very close to 100% for detecting. So that means it can detect a case of COVID if it's there, material from the virus if it's there. So there's a small margin of error. But as I said yesterday, the virus particles or the particles of RNA, the genetic material of the virus, it's what the test detects. That can be there, but not able to cause infection. So just because the the material is detected does not mean that the person has an active infection or is capable of spreading the disease. So it's not so much that it's a false positive as much that it's the detection of material, but the inability to cause disease. So that's one of the things you have to look at with this type of test.
Okay. And when people apply for exemptions to enter the province, how quickly can they expect to hear a response? Because some people are hoping to get into Newfoundland, Labrador to care for a relative who may be near the end of life.
Yes, so we're hopeful that, as the minister said, there was over 500 requests that came in just over a period of a couple of days. So it will take a little bit of time for people to get through those. The process has been streamlined right now, and so we're hopeful that people will be able to receive a response within 48 hours or so. And I think, if at all possible, if people are aware that they're going to need an exemption, we would certainly advise that people try to apply for it in as far as in advance as they can, so that it will give them time to be able to make plans and to hear back. And if something is urgent, certainly the exemption requests are being screened, and anything that appears to be more urgent is being dealt with first.
Thank you.
Our next questions are from Holly Mackenzie-Suter of the Canadian Press. Please go ahead.
For Minister Haggie about the Public Health Protection and Promotion Act. Just reading, Section 50B says inspectors can enter any premises to administer the act, and the definition of premises includes structures designed or used as a residence. So can you just explain how that kind of squares with the comments that inspectors can't enter private dwellings?
50 sub 2 says, notwithstanding Section 1, you can't enter a dwelling house without a warrant.
And inspectors are different than peace officers, I will add that. Inspectors are designated under the Act.
Okay, thanks. And wondering if you're aware of any situations that may have already arisen where the police felt they weren't able to enforce an order because they didn't have this mechanism to detain or transport people?
I've not been made aware of any after discussions with Justice and Public Safety. The awareness of this as an issue came late Friday through Justice and Public Safety, brought up by both law enforcement agencies and their counsel. I'm not aware and was not made aware in discussions that they had actually encountered it. I think it was more of a concern that they could, and that our expectations of what they could do would not be met with the Act before it was amended.
Okay, and in the House of Assembly yesterday, there was some discussion about expanding the categories of people that would be exempted from the travel ban. Is that going to happen, and when can we expect that to be added to, the order?
The categories under the travel ban, what happened yesterday was the order was clarified. There was a category, if you like, of quotes, discretionary, unquotes, exemption through the CMOH. Examples in the FAQ were given. And what happened yesterday was Dr. Fitzgerald's team revised that to include the examples of specific named categories for exemption. So, for example, if you were permanently relocating to the province, or if you were coming home to look after a sick relative, these kind of things, rather than having to look in the FAQ, they were actually listed in the order. From an operational point of view, Dr. Fitzgerald and I discussed this morning how that would actually make the task of her staff a lot easier, because the exemption would be granted a lot quicker in the sense it wouldn't rely on a case-by-case discussion of the particulars. So what we did was simply move areas that were already listed as examples and actually specified them as categories under the order, the exemption order.
Thank you. We have time for about 3 more questions. So if you would press *1 and identify yourself, we'll answer your question.
Ben Murphy, your line is now open.
Thank you. Premier, we saw another case of assault and forcible confinement over the weekend. With all the people that have joined the panel here to speak, is there any chance, or when are we going to see someone from the Department of Status for Women speak with some of the domestic violence issues?
Well, we have communications mechanisms in place with all our departments, and directors of communications, and that they're in place with all the departments. So I guess what you want to do is just reach out to the departments to put a media request in, and these are typically handled by the director of communications within those departments.
Next question.
Our next question is from Peter Cohen from CBC. Please go ahead.
Dr. Fitzgerald, I'm wondering if you can give us an idea what percentage of the exemptions are being denied, and can you give us some examples of the sort of things that you're not granting an exemption for?
So I don't have that information about the percentage that are being denied. As I said, with over 500, our staff are right now, their priority is to get through those and to make sure they identify which ones are the most urgent and answer those first. So once we do have that process ironed out, we will be able to provide that kind of information for you. But right now, we will not be granting tourism. If anyone is applying to come and visit just for a visit, that won't happen. And anyone who's not relocating, if they're coming home just to spend some time at a cottage or a cabin or a second home, we won't be granting those.
Next question, please.
Thank you. Our next question is from Kellyanne Roberts with NTV News. Please go ahead.
Thank you. I'm wondering about some more clarification on the Pleasant View Towers and its COVID-19 unit. Will they be using separate elevators? How will there be no contact between these cases and other residents?
That would vary from location to location, and I think you might have to go to each RHA pretty well to find out. The principles and the guidelines about how to do that are very clearly laid out by infection and prevention control specialists at each RHAs, and they meet national guidelines. How they do that in the Health Science Centre versus, say, Central Newfoundland Regional Health Centre, I think would be a question for the RHA.
Thank you.
Okay, we're going to take two more quick questions, and then we will end the session for today. So our next question, please.
Peter Jackson from the Telegram, your line is now open.
Hi, I just wanted to talk again about the tourist situation. Has the department, either through its own investigation or through the authorities, actually identified any wayward tourists before or after this legislation?
Not yet.
So, Peter, what we're seeing around the province is, some people would come home, some of the rent-a-car companies, as an example, would use, vehicles that would have Nova Scotia license plate. We've heard all kinds of examples. And we have a reporting mechanism that's in place for those that, would have questions around specific sightings of, those examples. But, we know that from a rent-a-car point of view, we see a lot of Nova Scotia plates that have, provided a fair amount of feedback through social media and so on. I know I've gotten some of it in my own district, but yet when you check into it, it really comes down to a rental car or something like that. So anything specific, as the minister just said, but we have the reporting mechanism in place. So if people are concerned, continue to fill out those reporting forms.
And our final question today.
Please press star 1 to ask a question. We have no further questions registered at this time.
Thank you very much for tuning in. We invite you to come back again tomorrow at 2 p.m. or 1:30 in most of Labrador. Have a great evening, everyone.